More Americans are becoming dissatisfied with an increasingly costly healthcare system that produces substandard results. We take a close look at Britain's experiment with government-run healthcare that remains popular but is facing mounting challenges. The NHS, or National Health Service, turned 70 this year. Meanwhile, despite spending more on healthcare than any other country, Americans continue to be worse off. The United States is the only large, wealthy country without universal coverage. Polls show record support for single-payer healthcare, even among a majority of Republicans. And an increasing number of Democratic officials have voiced their support.
Agenda progressive Democrats are vowing to give some form of free single-payer health care.
Let's give the taxpayers of the United States a better return on their investment, which means Medicare for all.
A majority of House Democrats have already signed up for socialist health care. It doesn't work. It's good if you don't mind waiting like 5 weeks to see your doctor.
In Britain, the NHS continues to have high approval ratings. Patients don't pay anything to see a doctor, and all prescriptions cost about $10.
We have the Commonwealth Institute report, which comes out every couple of years about healthcare, particularly in the G7, G8 type countries. And the NHS consistently comes number one.
But the NHS does face its challenges.
Under the cover of austerity, we've had a deliberate defunding of healthcare in this country, so it hasn't kept up with demand.
Horror stories coming out of the UK where they've had socialized medicine for decades.
Some of them are outlined in this recent piece published in Forbes titled UK's Healthcare Horror Stories Ought to Curb Dems' Enthusiasm for Single Payer. For a response, we spoke to two British doctors, Dr. Bob Gill of London and Dr. John Wright of Bradford.
So I think it's ill-informed, and I think if you work in the hospital where I work or with my GP colleagues, then if you need to see a doctor, if it's urgent, you can see them within minutes or hours. If it's not so urgent, you can see them with hours or days.
The reality is the Republicans and Donald Trump represent the interests of big business and corporations, and they're the people who have got most to fear from socialized medicine.
The article says the NHS is, quote, imploding. Vacancies for doctors and nurse positions reached an all-time high. Patients are facing interminable wait for care as a result.
Every health service is struggling with the demand. We have more doctors and nurses than we've ever had in this country, and the NHS, like other health services internationally, has grown to meet increasing demand. But what happens is that that demand grows faster than the supply of services. So we're always training new doctors, training new nurses to try and keep up. And there may be some vacancy issues in some areas, but a hospital like mine, we have 5,000-6,000 staff, and we have a very small vacancy rate.
You're seeing the NHS performance decline on multiple levels, waiting times, delays in treatment, but this is deliberate. How else could a government get away with privatising a system which is functioning well? So you have to manufacture a crisis, and that's what the defunding has done. So the headlines you quote are real. The NHS I'm trying to defend is not the original NHS. It's a part privatised system which is being set up to fail.
The problem is one of supply and demand. Single-payer systems offer, quote, free care, so patients have no incentive to moderate their demand for care. But government cannot procure enough supply to meet that demand without bankrupting taxpayers. Government officials' only option is to ration care.
So one of the challenges, and this is a big issue around the UK-US comparison. So the UK spends around 8% of its GDP on healthcare, whereas the US spends 16-70% of its GDP. So twice as much per GDP per capita. And what happens when you grow healthcare supply is that you start treating unnecessarily and you over-medicalise what's going on.
Well, this is applying market ideology and market terminology to healthcare. I'm a family physician. Nobody comes to my waiting room demanding care if they don't feel they need it or they don't feel they genuinely have a concern. People do not access healthcare for the fun of it. People access healthcare based on need. So to apply market justifications to healthcare is completely bogus.
And despite what American critics say, polls have consistently found that Britons would even support raising taxes to increase funding for the NHS. Meanwhile, some argue Americans need more than just a free national health service to address its inequities.
I think free access to healthcare is really important and makes a difference to health, but it doesn't get rid of the health inequalities between higher and lower social class people or higher and lower income people, because the nature of social and economic life is a more important determinant of health than the quality of the health care you get.
Unequal results are the natural byproduct of societal inequity, argues Professor Richard Wilkinson.
A whole range of health and social problems are worse. So, for instance, the United States has amongst the lowest life expectancy in the developed world. It has the highest rates of homicide. It has high rates of teenage births, high rates of obesity, very large prison populations, low levels of child well-being, low levels of social mobility. The only surprise is that they get worse amongst almost the whole population. The biggest effects of increased inequality at the bottom of the social ladder, but even middle-class people with good incomes and jobs and so on, education, would do better in all those ways if they lived in a more equal society. So they might live a bit longer, they'd be less likely to be victims of violence, their children might do a little bit better at school.
Stay tuned for our next report from England. We'll look at gun violence in the United States and the United Kingdom. For The Real News, this is Jessel Noor.